Welcome back into Good Morning Maryland, 6:52 right now. There's been more than 100,000 cases of COVID-19 here in Maryland, millions more across the country. Some of those are the very people caring for other coronavirus patients. WMAR2 News' Aaron McPherson has more on a new way for healthcare workers to protect themselves while caring for those COVID-19 patients. Aaron.
Well, Dr. Steve Trapello has been working here in Baltimore for several years, and just in the last few, he's spent a little more of his time creating medical devices. So when the pandemic hit, he knew he had to do something.
Put our gloves on, get our hands ready.
A Baltimore doctor simulates helping a patient.
CPR is being performed,
while making sure his team is safe using the Cove prototype.
It's very simple. The Cove is placed over the patient to isolate the viral particles, to keep them away from the provider, and at the same time allowing optimal care for the patient.
Dr. Steve Trapello is an emergency and critical care physician on the front lines of this coronavirus pandemic.
Now that testing is better, we're focused on these high-risk events that happen immediately. So people, can't breathe all of a sudden, lose their pulse. I don't have time to know what your COVID status is. So you need something that's immediately available.
This prototype is disposable and lightweight.
It easily pops open to be deployed. So you don't want a device that's going to take 10 minutes to set up on a patient when they don't have a pulse. This has to be done fast.
The Cove idea was sparked when Dr. Trapello had to intubate a patient back in March.
When COVID hit in March and people were coming to me saying, hey, use this plastic garbage bag, clear plastic garbage bag to intubate your patients, I just thought it was crazy, and I refused to do that.
There was so much unknown at the time and not enough PPE. So that's when he went to the drawing board with the team he's worked with before, creating medical devices.
We put pen to paper, we designed the Cove from scratch, and here we are iterating on it. This is the first, almost completed first production line quality Cove.
Over time, they've made some changes, like making sure the Cove was long enough to tuck under the bed and patient.
The drape is longest over the body, and this is what really allows optimal CPR. If you noticed, Ian was really able to slide his hands maybe up the patient's body.
And really focusing on keeping those viral particles away from healthcare providers.
The Cove will be under negative pressure from wall suction. You will hook up this tube to wall suction, and it will pull across the viral filter, so no virus will escape the Cove.
Dr. Trapello and his team is hoping to get these out to providers by the end of the month with help from Harbor Designs. Live from Television Park, Aaron McPherson, WMAR 2 News.